please enjoy the webinar, and I'm going to move on to our first speaker, who is going to talk about clinical practice. So if I could pass on to Claire Clarkson. Is that all right, Claire? Are you there?
That's brilliant. Yeah, thank you. And yeah, thank you so much. I feel absolutely honoured to be here presenting today. And a big thank you to Louise and Siobhan, who've been a driving force for this focus on specialist AHPs within GM. So hello, everyone. My name is Claire Clarkson. I'm a therapeutic radiographer, currently working within the Workforce and Education team within the Cancer Alliance as the Cancer Academy Programme Lead. So this session, we are going to explore the ASCEND programme, how this can support learning and development within the clinical pillar. So for the past 18 months, we've been supporting the implementation of ASCEND through various projects and forums. So with this session, I'm going to give you kind of a really brief overview of the programme, key learning we've had to date, and how the Alliance is supporting the workforce to implement this. So the Cancer Alliance has been involved since the inception of the programme. Myself, our Programme Director, Suzanne Lilly, and Senior Education Lead, Molly Pippin, also sit on the National Steering Group. So this allows us to provide that national insight and how this can influence local implementation, but also how we can feed back into the group with kind of experience within GM and real life application. Next slide, please. So the first stage is getting to grips with the programme and the framework and understanding how you can utilise this to support yourself but your team as well. So to be really brief, the ASCEND programme stands for the Aspirant Cancer Career Education Development Programme. So this is a national programme, and it has been recognised in the NHS Long-Term Workforce Plan as well as Cancer Alliance planning guidance as a recommended model to support reform. So it was created in response to workforce challenges. It was identified that though there are many nationally recognised frameworks out there for AHPs and nurses and other non-medical healthcare professionals, there wasn't one specifically for the cancer workforce. People within cancer careers often didn't know which direction to go and weren't aware of the options or opportunities available. So ASCEND is a multi-professional framework that provides clear guidance on the knowledge, skills and capabilities required by the non-medical healthcare professionals at all levels of practice, and really supporting that end-to-end career pathway and learning and development. So it offers the opportunity for the workforce all the way from supportive assistive right through across those levels of practice towards enhanced and consultant to develop and evidence their knowledge and capabilities, which will then support them to provide the best standards of care, as well as providing a meaningful structure for cancer career and role development. So it's really supporting career-long learning and development, and it's ultimately about helping support the workforce to have the right skills at the right time to provide the best care. So it can aid those wishing to progress, so those that want to move across those levels of practice. But it's okay to stay within your own role as well, or maybe progress sideways rather than up. And it's there to help people develop in their role as well. Next slide, please. So the programme itself is underpinned by the framework, which is built around these three core components. Now, the framework itself is currently only available as a PDF document, and it is quite a sizable document. So this is just going to try and break down those three components. So that's the development of a rewarding career pathway, so providing aspiring routes for those wishing to attain further levels of practice, the core cancer capabilities, which are mapped across the relevant levels of practice, and also the education required. So as we continue through this, we'll be kind of looking at those three components and seeing how it can enable AHPs to demonstrate their achievement of core cancer specific knowledge and the capabilities expected to provide the best care. Next slide, please. Great, so this is component one, which is the career pathway. So this part of the framework aims to provide recommended higher level education needed to achieve each level of practice. So many of us are aware there's quite a bit of variation across the system and even between the different AHP professions. So this is really aiming to provide that standardisation. Practitioners will know what to be expected of them and the level of learning needed to progress or develop within their level of practice. Next slide, please. So this is component two. So this is the core cancer capabilities in practice. So this makes up the bulk of the ASCEND framework. As you can see, the capabilities are aligned to the 4 pillars and then further split into 24 parent capabilities. So it's important to mention at this stage that the framework focuses on capabilities and not competencies, as this is about continuous development of knowledge and skills within a certain element rather than the achievement of a skill. In this session, we're obviously thinking about how Ascend can support that development within the clinical pillar. So as we know, clinical practice will look very different across each AHP profession. There are 15 of us and we all do very different jobs. However, this could really be a benefit because each profession does have such a clear defined role with, and responsibilities. It can be kind of easier to understand how Ascend could be integrated to support better clinical development and practice. And actually, I think when we look through the framework, we'd probably be surprised at how much is transferable across all professions. Next slide, please. So just to delve deeper into one of those areas that I think would be relevant to all is communication. So as mentioned, there are recommended kind of skills and knowledge required, and this is mapped to the relevant levels of practice. So there are many within communication, that relate to all levels of practice. And the evidence around that will be the variation of how each level apply that to practice. And it's important to remember that Ascend can be tailored to the team and the individual. Not all capabilities may be required, and that's okay. That's the beauty of Ascend. It can be used as and needed. And obviously this can be agreed with any line managers at one-to-ones and appraisals. Next slide, please. So component 3, as mentioned, is thinking around the education. So both accredited and non-accredited could be work-based learning. And this is about what education is out there specific to your role or profession that can help you in achieving, knowledge and skills that will help evidence and against the capabilities and transfer, how we transfer that to practice to enhance the care that we provide. So if we think about the communication capabilities, this may be the ones, mentioned within the framework here, such as enhanced and advanced communications, along with a psychological level assessment training. And I think this, what you can use the education is, it can actually nicely identify kind of what are the appropriate capabilities required for that profession or that individual within that certain role. Next slide, please. So as mentioned in other slides, the Ascend framework focuses on levels of practice, so it doesn't focus on banding. And what the framework does is it provides guidance on the type of roles that are normally associated with working at that level of practice. Again, we know that there'll be big variation, and this could be quite a new way of thinking about roles. But by focusing on levels of practice, we're thinking about what the expected capabilities and skills required at each level are, rather than banding. And we are aware, obviously, that there are some blurred lines within some roles. As you progress within your career, you'll be able to demonstrate and achieve capabilities related to the next level of practice. However, this is really good, actually, because this is how practitioners should transition. It allows better preparation for the workforce, and also for line managers, it can help highlight those who are ready for that next step into enhanced, advanced or consultant level practice. Next slide, please. So I appreciate there's a lot of words on here, but it was just to kind of highlight key learning and how this can inform how we can utilize the framework. So a reminder that this framework is for the whole workforce, even though obviously we're thinking about it through that cancer lens and a cancer perspective, it is for everyone. Therefore, one size will not fit all. And this will be applied differently depending on which AHP profession. And it's about how it can best complement their development and what they need for their role. It will also be used differently for those new to role or those already established within their post. And the main thing here to know is that's fine. There isn't a one way to do this and an only way to do it. And it's about kind of how we can support throughout the career journey, from workforce planning to onboarding, induction, and to appraisal and service development. So when thinking, back to I mentioned at the beginning, the NHS long-term plan, Ascend can support the key themes mentioned, such as promoting and attracting people into cancer careers, reducing attrition by developing talent within teams at all levels of practice, and aiding meaningful progression. So we know not everyone will see themselves as a cancer specialist, yet we all do need to have some core cancer capabilities, as we all support those living with and beyond cancer diagnosis and treatment. And Ascend is kind of that perfect perfect kind of overarching framework that could help kind of enhance the care we're providing, enhance the other frameworks that we may be using. Next slide, please. So how can AHPs get involved? So the key to Ascend is working together. So it's really important. So from the individual, the team, the line manager and organisation, that we work together to kind of set standards across the three components. We are aware that there are other frameworks out there that each AHP profession will be using. So it's about exploring how Ascend can enhance learning and development, and ultimately about supporting the workforce to have the right skills at the right time to provide the best care. So this is just to mention a number of ways that the Alliance is trying to support the implementation within teams and organisations. So we have some cancer education development leads. We have Claire Greenbaum here, and we also have two at NCA and MFT that are supporting implementation. We have the Cancer Academy that I think Molly will be going into a little bit further, and the Cancer Academy e-portfolio that can support implementation. We also have the Ascend Multi-Professional Community of Practice and the AHP Community of Practice. And we also have some Ascend implementation resources available on the website. Next slide, please. And I appreciate that's a lot of information all at once, but this was a really brief overview, and it's more about creating some curiosity and starting conversations on how Ascend can support using AHP or a line manager to support development of others. So please do reach out and see how you can get involved, whether that be with the community of practice or finding out more about Ascend. And just a big thank you to everyone for joining us today, and to all my fellow AHPs, enjoy the rest of your day. Thank you.
Thank you, Claire. What a great start. Hopefully that's whetted your appetite. We're going to move on now to Molly Pipping, who's going to talk to us about the education pillar. Thanks, Molly.
Thank you very much, Vic. Yes, so thank you very much, everyone. I'm Molly Pipping. I'm the Senior Programme Lead for Education at the Cancer Alliance. And as Claire's already mentioned, today I'm going to talk to you about the Cancer Academy and how, as a Cancer Alliance, we're delivering education to support you and your professional development. Next slide, please. However, before I get into this, I just wanted to go off script for a little bit, for just a short moment, because just to bring this back, I suppose, to myself. So I'm not an AHP. I'm not clinical by background, but 5 weeks ago, my dad had a stroke and he's on a long-term rehab ward. And I suppose I have a completely different level of appreciation for the work and the care that you give as AHPs, not just to the patient, but also to those families. So today, when I'm talking to you about education, I want to focus on 3 core elements that really underpin it. Yes, it's about your role, and yes, it's about the care that you give to patients, but it's also about you as a person, as an individual, growing and developing and investing in yourself. So I suppose the immediate thought for anyone when you think about education is, oh, this is about theory. But for us at the Alliance and beyond, it's so much more than that. So education is about developing those hands-on practical skills, making sure that you can practice those effectively and safely. But it goes far beyond just explaining how to do things, but why we do them and why we do them that way. So I know that as a workforce, whether you're an AHP or not, we're also incredibly stretched, and finding time to invest in yourself can sound really unrealistic. But education is one of the 4 pillars of practice for a reason. Education helps you stay sharp. It helps you stay relevant in your practice. And when we talk about lifelong learning, that's really what we mean. The ability for you to adapt, stay relevant in your practice, give that best care to your patients, but also support the development and progression within your career as well. So next slide, please. As a Cancer Alliance and as part of the workforce and education team, our response to all of these types of issues is that we wanted to create a hub of education where you could come and find all of the training you need in relation to cancer care. So we established the Cancer Academy. Our reasoning behind it is that we want to elevate cancer care, and we exist to inspire, educate and improve our health and social care workforce. So we work across all care settings, primary, community, social and secondary care, all about making sure that we can equip our workforce with the skills and tools necessary to deliver best patient care, and being responsive to the current and the future needs of our population as well. So, of course, everything that we do supports the long-term plan ambitions for cancer care, the long-term workforce plan, and Ascend, as Claire has just gone through. But one of the real beauties of having an academy is that it reduces that inequity around access to cancer education. We so often talk about that postcode lottery, areas of deprivation, pockets of good practice across the patch. So really important that we can support standardising those offers, and that it doesn't matter where you're treated, you get the same standard of care. And I think a bit of a USP for us is that everything that we do is driven by workforce need. We do a lot of surveys, focus groups, just to ratify our direction of travel, make sure that it's what you need as practitioners, but also making sure that we use the Ascend framework to find out what those needs are, but really making sure that we can instill that culture of taking control of your own professional development. Next slide, please. So every year we create a blueprint, and this is what 24-25 looks like for us. And there's a lot of information on here, but it's just a snapshot really to show you the breadth of information that you can find if you go to the Cancer Academy website. We work with all of our site-specific pathway boards within the Alliance, as well as some more cross-cutting themes. Things whether you work within cancer services or not are really important, around red flags, signs and symptoms for cancer diagnosis, thinking about health inequalities, operational performance, and of course personalised care is something that is pertinent no matter what discipline you work within. Next slide, please. So we've been established for a couple of years now, and it's really interesting when you start to look at the data in terms of who's engaging with us as a Cancer Academy. And I just wanted to share this with you because we know that we need to do a little bit more work to make sure that we're engaging with you as an AHP professional group. And obviously today is a great starting point for that. But also to maybe make it a little bit more competitive for you. So we've got 4,000 registered users on the Cancer Academy website, and 317 of those are you guys as AHPs, 192 from across Greater Manchester, and 125 from other cancer alliances. Now, we may not know how many people work within cancer services who are AHPs, but I do know that there's definitely more than 192 of you, especially if we extend that to generalist AHP roles as well. So it would be really great if we can really capitalise on that and really push that message in and get more of you engaged with the content that we have on the site. A bit of a breakdown there in terms of care setting, most of you coming from secondary care and then even split between primary and community. But we also have some ethnic data as well. And I think it's really interesting when we drill into this, that actually 80% of the people who engage with us are white British. We definitely need to do more in this space to make sure that we are offering equal opportunities to our workforce, because I would assume that that isn't representative of what our workforce looks like across Greater Manchester. Next slide, please. We can also see how long people have been in post for. So one of the things that's great to see is that over 50% of you on the webinar today are in the first 4 years of your AHP career. So I hope that you're enjoying what you're doing, and it's great that you're finding time to support your CPD. And for those of you who've been in the role 5, 10, 15 years plus, thank you so much for joining as well, making sure that you continue to advocate how important it is that your fellow peers who are starting out in their roles continue to invest in their education. Next slide, please. So I just wanted to put up a little bit of a snapshot, because I think when we talk about the Academy, I know I've explained what the vision is and all of those offers that we've got, but I think people go, well, what is it? So I've said it's a bit of a hub of education. You can visit our website, which is gmcanceracademy.org.uk. This is what it looks like. You can navigate through the different site-specific academies. You can find some more generic offers as well. The majority of the education that sits on the website is free at the point of access. However, some of the offers do sit behind a paywall to support with the facilitation of those. And I suppose I want to make sure today, when we're talking about education, you actually understand how you can access those offers, whether they sit with us or outside of us, if they are behind a paywall. So next slide, please. I'm not sure if everybody is aware, but if you work within the NHS, you have a CPD funding entitlement. This has come through the Department of Health and Social Care. It's for all nursing associates, nurses, midwives and AHPs. There is still funding available up until the end of this financial year, so until March 2025. You can contact the CPD lead within your organisation and put in an application to tap into your entitlement, which is £333. You probably have to fill in a study leave form, make sure you map it to some of those capabilities in Ascend that Claire was talking about, just so that the organisation can see what they'll also get from it. But really important to say that this funding is for CPD, so that continuing professional development. It isn't for core mandatory training. It's about what will develop you as an individual. And I wanted to give you a few offers that you could potentially look to invest in as part of that. So next slide, please. As part of the Ascend framework, there are these core capabilities in practice that Claire was just talking about. And one of the areas that is pushed really strongly is around communication. We know that actually the biggest cause of complaints within the NHS is down to communication skills. So we wanted to make sure that as an alliance and via the academy, we were doing what we could to support you as a workforce to have those good communication skills that underpin best patient care. Next slide, please. So this is a bit of a snapshot, and this will be available on demand afterwards, and we can share some further info. But we've broken it down into the levels of practice against the Ascend framework, and then what that looks like for you in terms of the education and training you need in terms of communication skills and psychological care. These are all offers that we can deliver via the Cancer Academy, and you can find on the website. So if we go to the next slide, please. A great foundation and starter for anyone, no matter what level of practice, is our communication skills training that we've done in collaboration with the LGBT Foundation. So this is around having inclusive conversations and using empowering terminology. Completely free at the point of access. It's an hour of CPD and a real great foundation for you. It was also nominated for a HSJ award, so we'd really encourage you to go and look at that one. Next slide, please. Following on from that, we have our communication skills offering. So if you're a support worker within the AHP workforce, then the enhanced training is coming in the new year. So just make sure you're a registered user on our site. But if you're a specialist AHP, then you're entitled to access advanced communication skills training. So we're delivering this slightly differently through the Cancer Alliance. We're leveraging technology, working with a company called Recourse, so that there's a bit of theory and then you go into the practical online simulations where you can practice breaking bad news, de-escalation, and you can do that in a safe and controlled environment. You can do the scenarios and the simulations as many times as you want, and you get real-time feedback. Really clever, really empowering technology, and would encourage anyone who hasn't got their advanced communication skills to go and get it. If you can tap into that via the academy, as I said, you can drop us a line. It's £350, so a great opportunity to utilise your CPD funding to access that. Next slide, please. And following on from that is psychological care training. So your communication skills, whether that's enhanced or advanced, is a prerequisite to getting accessing this training. So there's 3 modules for those who are supportive and assistive, those foundations in psychological care that you can see on the left. And then for those of you who are practicing at enhanced, advanced or consultant level, you would need psychological level 2 training. So 5 modules there, which is consolidated by a full day of face-to-face learning. So just a bit of an idea in terms of how progressive packages can be and how you can tap into them at different levels of practice. Now, I'm conscious of time, so I'm going to move on to my next slide, which is a video, and then it will round off this presentation. And of course, there's questions at the end. But of course, it's all well and good that we are talking about education. We've talked about Ascend, but actually, how can you then use that for yourself as a practitioner? So we've created the e-portfolio, which is a digitized version of the Ascend framework. We really hope that this is going to help you have more informed appraisal conversations and support your revalidation. So every time you do learning, whether that's via the academy or another quality assured education provider, you can log your learning in the e-portfolio and take that to your next conversation. So hopefully this video will work. If the sound doesn't work, that's fine. It is captioned and it's only a minute long. So can we try and play it, please, Susie?
Introducing the new Greater Manchester Cancer Academy e-portfolio platform. A brand new system designed to support you with your professional development. With the e-portfolio, you'll now be able to log your learning achievements and highlight development opportunities to progress with your career. You'll also be able to have more informed appraisal conversations, as well as support with revalidation. The ePortfolio is centred around the levels of practice in the ASCEND framework: supportive, assistive, pre-registration, registration, enhanced, advanced, and consultant. We've also created the speciality-specific frameworks for each cancer pathway. So whatever level you're currently at, you'll have the resources you need to progress in the palm of your hand. Find out more and create your ePortfolio at gmcanceracademy.org.uk.
Great, thank you very much, Molly. That was great. We are now going to move on to the evidence research and development pillar, and Kelly Owen is going to take us through this one. You there, Kelly?
I am. Thank you very much for the introduction.
Thanks.
Hi everybody, and thank you to GM Cancer for inviting me to speak today at the webinar. I'm a dietetic advanced clinical practitioner at Salford Care Organisation, part of the Northern Care Alliance, and I specifically work in the esophageal gastric cancer tumour group. So today I'm going to speak to you a little bit more about the research pillar that we have towards our advancing practice. Next slide, please. So we have evidence research and development for AHPs in cancer care. So really I want to look at enhancing outcomes and how we do this through innovation, evidence-based practice and research, and I'll give you some kind of links as to how this then links with the ASCEND framework as well. Next slide. So we all know that as AHPs, we play a pivotal role in cancer care, and that might be either as a supplementary role, so it may just be part of your role alongside other specialities. You may work solely in cancer care, but our role is pivotal to improving patient care and patient outcomes. And we all know, again, through training in our professional bodies and the professional work and clinical work that we do, that evidence-based practice improves the quality of this care and patient outcomes. And the research and innovations and development that we do are essential to advancing clinical practice as well. And the ASCEND framework that both Claire and Molly have touched on, hopefully have now shown you that it provides a structured pathway for AHPs. And one of those areas obviously is within research, clinical development and innovation, so quality improvement as well. And all of these things align together so that obviously we can improve ourselves both professionally, but improving the care of our patients. Next slide, please. So evidence-based practice in cancer care. We know that this is obviously enhances our own clinical expertise, but it also enhances the patient's values and their experiences that they have during cancer care as well. But it relies on the best research evidence that's available, that's out there. And it's important, I think, as AHPs that we become a lot more prominent, perhaps, than we have been in the past in terms of starting research. And it may be on some smaller projects, but obviously it's also about expanding that to get into some higher end research so that we can make sure that AHPs have a voice for our patients when it comes to the best available research. This again connects to the ASCEND because it is part of the foundations for our professional development, but it also supports us in being able to apply that research then both clinically to enhance patient outcomes. It also allows us to then look at how we develop each of those individual skills around research. So it may be about small niches of things that you need to improve on. It'll be maybe critical appraisal skills at the beginning, or literature review, how to undertake those, or how to do a literature search. But then it's about implementing those and bring them all together and applying them into different clinical settings. Next slide, please. So just to give you some examples of kind of research examples within AHPs who work in cancer care. So you have rehabilitation and exercise. So I'm sure a lot of you have heard about prehabilitation and rehabilitation before and after oncological, surgical and treatment. And there are many AHPs who've been involved in a lot of the research work around this. There's also other research that demonstrates the benefits of post-surgical physical therapy. So looking at, say, physiotherapy and lymphedema services. There's the nutrition, so the involvement of nutrition in managing treatment side effects through dietary interventions. So there's research being done in the role of FODMAPs, which are particular types of carbohydrates, and the involvement of the symptomatic management of the gastrointestinal side effects that follow cancer treatments. There's a psychosocial support research element that we need to be looking on. So again, Molly's just touched on that in terms of the communication skills and, upskilling ourselves in the different levels of psychosocial support we can give our patients. But we need to be looking at these research-based interventions and how they help patient recovery. So certainly there is work being done by occupational therapists in the roles of CBT or psychological level 2 training and how this supports our patients. There's also the palliative care and symptom management research agenda. And again, this is also linked into survivorship in cancer care. So that this might be specifics like looking at maybe speech therapy in head and neck cancer patients or in MaxFax. So specialising in perhaps dysphagia care and speech recovery in these particular tumour groups. Again, it links to ASCEND, so it encourages the specialisation of these specific areas. So I've mentioned here lymphedema, gastrointestinal side effects, speech recovery, but it's then how that guides you in your career progression and how you can then kind of make sure that AHPs are at this cutting edge of the next parts of research. Next slide, please. So our role as AHPs, we are innovators, so we need to be involved, however small that part might be, in being innovative. So it could be involved in some clinical trials, maybe not as a primary investigator. You may just do some data collection. You may start with some easy things, quick wins like service development, audits. You may want to just be involved in a research project with somebody else who is a primary investigator so that you can get involved in maybe some statistics work or writing an introduction. I know Vic's going to come on as well to the leadership side, but all of these things work together in collaboration with research. So, being involved from a leadership perspective allows us to foster those kind of MDT relationships and being able to apply research then into kind of everyday practice. So multidisciplinary collaboration is really important. So it allows us to work with some of the oncologists at other sites, perhaps, that are not there in our everyday practice, or working with other nurses or other allied health professions to advance cancer care. Next slide, please. So what can be the challenges in cancer research? Well, I think these are some of the things that I've certainly found during my time whilst trying to get involved in research more. It's the limitations on funding. So AHP-led research can be a struggle to secure funding. But speak to people, this collaboration. If you work with other people, work with research departments, they can put you in contact. They can signpost you to the relevant areas where you can get funding. And it may be very small grants, but it's important that you kind of do that and link in with these people because they know where the resources are. Time constraints as well can be really difficult because it's balancing that research aspect with clinical duties, but it's how you then balance that as part of your job plan when you're speaking with your managers during your personal development reviews. There are massive data gaps, but we know that research-specific agenda items for AHP interventions, there's a limitation. There doesn't exist as much AHP intervention-led research, and that's something that we should be really pushing on as a profession. And it's that clinical integration of the theory then and translating that into practice. And ASCEND can help with that. So that research engagement, it gives you a structured career pathway and encourages research to be part of your job role. It also helps kind of career progression and linking that research. So embedding those, implementing evidence-based practice and the critical components that are needed to link between clinical practice and academia. Use the collaborative opportunities that I've mentioned. So again, making sure that you're using interdisciplinary working or education sessions you have with others helps you to address kind of maybe resource gaps or research agenda items. Next slide, please. So strategies for overcoming some of these challenges, and these perhaps are things that I've come across during my time, so kind of drawing on my own personal experiences. Collaboration, so work with people that you know. If you don't know, maybe somebody else you do know knows the right person to speak to, and that might be partnering with academic institutions, or knowing perhaps another specialist who works at an academic institution who can put you and signpost you onto somebody else. You may seek other advice from other support agencies, so other allied health professions, nurses, surgeons, oncologists. And it doesn't have to be, like I mentioned already, that you're a primary investigator to begin with. I've been involved kind of in small subsets of different kind of elements of research to kind of get my journey on the road. So that's kind of included Cochrane reviews, analysing data on a study, writing introductions, then being involved in the write-up and the discussion, and being able to critique some of the statistics or critique some of the data that's there, or your discussion. Again, apply for funding, so trying to seek funding through grants or your own professional organisation, so that you can open the doors to allow you to maybe integrate your clinical work with both your academic work. So maybe start small. So your professional bodies may have some small grants. There are the CAFA bursaries that are available, and they give you some small pockets of backfill that allow you to then integrate research, maybe for 1 day a week and for 6 months, so that you can get your project off the ground. There's the NIHR research internship, clinical academic programmes, but you can get other funding from cancer or AHP related organisations such as the Wellcome Trust or the James Lind Foundation. I personally did the NIHR research internship, then went on to do my master's degree, and now I support my team with applying for CAFA bursaries and other professional body funding as well. And I say it's great because it helps to support and input that into everyday practice, because you get that clinical backfill. And take time for that professional development, like Molly was saying, you know, maybe take some time out to reflect and self-analyse about where you are now and where you want to be. What's your game plan going to be, and how you're going to get there, and how can maybe Ascend help you in supporting you to get there. Next slide, please. So where do I see the maybe future direction of R&D in AHPs and cancer care? So I think there'll be a lot more on tailored interventions, so looking maybe at patient genetics and how lifestyle interventions are more specific based on those patient genetics. There's been a big move towards digital health innovation, obviously with COVID over the last few years. So the use of telehealth and mobile technology and how that can enhance patient monitoring and delivering care. There's also been a move, I think, more recently to looking at qualitative data, so making sure that there's service user and patient involvement in research. There's also integrative oncology, so looking at the more holistic approach that again links in with Ascend, so looking at different complementary therapies and how they support cancer care, so acupuncture, music and art therapy. And then there'll be the lead on of artificial intelligence and the use of data, so being able to use this data to predict patient care and outcomes. Next slide. So in conclusion, we know that evidence-based practice and research are crucial for advancing cancer care, and I believe that AHPs can be at the forefront of advancing care. It's just how we block our time out, how we protect that time to move that forward, and how we make that part of our own professional development. We can lead research efforts that include kind of driving innovation and being more collaborative and provide high quality patient-centred care. And I think, again, that links with how we will do more qualitative type research. And the Ascend framework obviously provides the AHPs with a structured approach really for integrating research into clinical practice. So again, I kind of call you all to action and encourage you to use the framework kind of to help you to engage in research, you know, seek opportunities, advocate for your evidence-based practice, push the boundaries of what's possible in cancer care. And I wish you all good luck. Thank you.
Thanks, Kelly. That was great. Okay, so we are going to move on to myself. I'm going to talk to you about leadership and management. So just next slide, please. I obviously introduced myself as the Chief AHP. I'm a physio. I'm an MSK physio, so I'm not a specialist cancer physio, but I do see quite a lot of patients in my clinical practice, which I still do, not obviously full time, but I do see quite a lot of patients with cancer, and obviously lots of staff that work in the NTA. We do have some specialist AHPs that work in cancer, but we also have a lot of others, and you know, the encouraging people to be part of the Ascend framework, use it, is one of my big passions at the moment. So just going to really quickly give you a bit of a whistle-stop tour of my leadership journey and some top tips. Just to start off with, I suppose I never set out to be a manager or a leader, but I think I have always been a little bit bossy, so I can sort of see on reflection how I've got to the position that I'm at. But one of my top tips throughout this is be open-minded. So just move on, next slide, please. I'll just talk you through a few sort of key points in my journey. So I graduated as a physio in 1993, and I was, you know, very career driven, and quickly sort of moved through the junior ranks of being a physio, and then enrolled on my first sort of postgraduate sort of accredited qualification and did an MSc in sports physio. And at that time, I also got my first sort of leadership position, which was as a clinical specialist physio in an outpatient department in Salford. And it was at this point that I undertook the first leadership qualification that I did, and it was the RTN Clinical Leaders course. So that was obviously a nursing qualification, and it was an 18-month programme, which really challenged me to look at myself. And if I'm being truthfully honest, I wasn't ready for it. I wasn't in the right place. I was you know, I was very driven. I wanted to get something on my CV to say I'd done a leadership course, and I was sort of ticking a box. And going through it was quite painful for me. But it you know, I was a bit like, oh God, they're asking me to look at myself here. They're asking me to understand myself a little bit more. That's not something I'd ever done before. However, you know, again, on reflection and in hindsight, that was a real turning point for me. And I would say that's where I moved from being a manager to a leader. And although it was painful, going through that process over a long period of time and sort of being more engaged in it was really beneficial for me. You probably know, because of what I've already told you, that I am passionate about clinical care and being able to still be a sort of a physiotherapist. So when I got the opportunity to apply for a physio manager's job in 2004, I was a bit like, I'm not sure I want to do that because I want to stay being a physio. However, I did do that job, and I did maintain my clinical practice. So again, once you become a leader or a manager, part of that is making sure that you can articulate what you want and what you're going to do in your development as well. So I would encourage you to make sure that if you are going for a new job and you're thinking, I'm not sure, you know, think broadly about it. Think about the benefits of doing something a little bit different, but also if you want to, you know, hang on to a little bit of something else or do something a little bit differently, you know, speak to your manager, speak to the people that are appointing you, and have a conversation about it. Don't give things up without putting that challenge in. So at that point, I was still in my physio world. I'd not really branched out into other professions. And then due to a change in organisational structure in 2005, I became an AHP manager. So I started leading other professions that weren't my own. 2007, again, through different restructures and organisational restructures, my job title changed to be a physio consultant. And again, I was still leading multi-professional teams at that point, and sort of getting involved in leadership at different levels. Around this time, I did my second leadership qualification, which was a Northwest Leadership Academy qualification, which was external to the organisation. The first one was internal. It was with all people that I worked with. The second one that I did in around 2007, 2008 was external. So I was doing a leadership course alongside people in a similar sort of hierarchical level to me, but in different organisations, and that was really beneficial as well. I then got an opportunity to apply for a clinical lead job, which was traditionally a medical job, and that was to be the clinical lead of rheumatology. So this was around working with the rheumatology consultants who I worked alongside clinically, and an opportunity came about to step into that traditional medical leadership role, which I did, and learned so much from doing that, which then led me to be able to move into a clinical director post, which was tertiary medicine. So that was over rheumatology, haematology and immunology. And again, doing that, sort of my leadership journey sort of went on another level at that point. And alongside that, internally within Salford, where I was working, I did a clinical directors leadership course. So alongside other clinical directors within Salford Royal. So I was the only non-medic doing this programme, and that was a 9-month programme. And again, I learned a significant amount within there. When you do some leadership qualifications, the theory doesn't really change. The theory is pretty much the same, and it's quite reassuring. So I've now done, another couple of leadership courses. I think they've all come about at the right points in my career to help me with the challenges that I'm experiencing in a new role that I've taken on at that point. So although you think I've already done that course, I've already learned that theory, I've already looked at what the difference between transactional and transformational leadership is, the bit that's really important is about your development and what you're getting out of that, where you are in your life. And that's not just you as that's you as a person. That's not just you in work. That's what else is going on outside your life, outside of work, within your life. Whether different things mean different, mean you behave in different ways. So I would encourage you to, on your leadership journey, to do different courses and think about different things. I took on the role of Chief AHP in 2018, and again, that was a big learning curve and a different leadership job, working at the level that I work at the moment within the Northern Care Alliance. And I still feel like I'm learning on a daily basis. At the same time as taking on that role, I did MBA, which again is a second master's, obviously, but that was nothing to do with healthcare, but learned so much within that. So there is definitely an overlap between my leadership journey and the education pillar, obviously, because they don't go exclusively, they're not exclusive to each other. But I think people sometimes do struggle to recognise the fact that you can be a leader at all levels. So I just encourage people to sort of think about that as well. So when you're the Ascend framework is brilliant. There's loads of stuff in there, but whether you're a band 3, a band 4, a band 5, whatever level you're at, there will be some leadership in what you're doing, and picking that out and developing that is a real key. I would encourage you to use formal educational courses to help you with that, because I don't think I would have got to where I am now with understanding about myself and being able to look at those other roles without doing those formal programs as well, because they really pushed me and pushed my sort of personal development. Next slide, please. So top tips, I suppose, would, for me, this is my personal thing, is prepare yourself. So, thinking about your career and thinking about the Ascend framework and all the things that are in there, use some time to get yourself ready for the next step that you're thinking about. Don't always look upwards, look sideways as well. So a sideways move can be great for your leadership development as well as a promotion. Be brave and maybe do things that you are outside your comfort zone, but do that in a calculated way. So don't just drop everything to take something else on. Think about it. And then finally, use the support networks around you. There's 123 people on this webinar today. We've all got a common interest. There's lots of people around you that you work with. Use them, talk to people, get a coach outside of your organisation, and finally use the Ascend framework, because that will definitely help you. Right, I'm going to stop talking now because we are going to move into questions and answers. So we've got 5 minutes left. So we've run over slightly, but hopefully we've got time to answer some questions. So there is a question in the chat box about completing the an internal enhanced communication course, and is that the same standards as the advanced communication course? I wonder whether, Molly, do you know, can you help with this one? Thanks.
Yeah, no problem. So yeah, thanks for your question, Courtney. I know Marie Roberts runs their in-house courses at NCA, and I've had a conversation with her about this. Happy that the course that you've done that's labelled enhanced is that advanced standard. She's done that, train the trainer, so that's all good. So happy for you to access your psychological level 2 training. I probably think that we need to do a little bit more work just to make sure we avoid confusion moving forward around the terminology used around that within NCA. I know you're a large organisation, so we'll pick that up outside the meeting with the relevant people. But yes, to answer your question, you can access psychological level 2.
Thank you. I can't see another specific question. I don't know whether anybody else from the team can. The main question is, has the presentation been recorded? And yes, it has. So we will make sure that the recording is available for people to watch back. Any more questions, people, feel free to put your hand up as well. We've got 3 minutes left. Or pop it in the chat box, or Wendy.
It's just about the e-portfolio. How can people access that? Do you just register and then can you automatically access it? Is that how it works?
Molly?
Yeah, Wendy, are you from Greater Manchester, Wendy? Are you from outside?
I'm from Clatterbridge in Liverpool.
Clatterbridge. Oh, so at the moment, the e-portfolio is only available to staff working across Greater Manchester or Cancer Alliances who've signed up to a licence. So Cheshire and Merseyside haven't signed up yet, but they do have a contract that they're currently reviewing. So if you signed up to the Academy, and you will be because you're on this webinar today, you'll get email correspondence as and when the e-portfolio becomes available for you to access. But in the meantime, if you go to the Academy website and you go to the e-portfolio page, there are some additional resources on there that you can access right now. So there's an implementation handbook that Claire's completed for line managers and teams, so you can understand what you can do on the ground to really start supporting the implementation of Ascend.
Okay, thank you.
Thank you. Okay, we've got another question about asking if the e-portfolio is transferable to the ACP digital badge e-portfolio.
Yeah, thanks, Vic. And thanks for your questions, Charlotte. We've started to unpick this internally, and Claire Greenbaum, who's our education and development lead, is an ACP by background. And I know that we've picked up some of those conversations, but Claire, I don't know if you have anything that you want to add to that one.
Yeah, so you could definitely use parts of your e-portfolio. So if you're using the Cancer Academy e-portfolio, you can definitely use the evidence that you've collated there, but it would at the minute need to be transferred to kind of the e-portfolio platform they're using. But you could definitely use what you've entered into the e-portfolio to transfer across. And it's about applying that to practice, you know, providing that evidence and getting you thinking about that, kind of reflecting back, how has that actually impacted and influenced my practice? So yeah, you can definitely use it. It's just a bit of a separate system at the minute, but as Molly said, we are in discussions of how we can make it as easy as possible for people to use.
Thank you. Okay, it's 1 o'clock, so thank you everyone. Thanks to all the speakers. Thanks for everyone that's joined and the questions. Just like to wish you all a very happy rest of the AHP day. Please do join the social media stuff and use the hashtags, and yeah, enjoy yourselves. Thanks very much.